Thank you so much, Andrew. I am Ginger Heidel with the Coastal Health District, and I'm excited to tell you all tonight about a new program in our district that is supporting the health of moms and new babies. And I'm joined by Kelly Evans, who is a nurse with our district's Home Visiting Program. Thank you so much for being here with us tonight.
And thank you for having me.
Yes, so your program focuses on the health of pregnant moms and the new babies up to 1 year who have some healthcare conditions or some other challenges that may result in some bad outcomes during that pregnancy in that first year. Why do some moms and babies need a little extra attention during this time?
Yeah, Ginger, thanks for asking that. So with pregnancy, a woman's body goes through a lot of changes. We take for granted when we're healthy that all those changes just happen automatically. But if a woman has, let's say for instance, chronic hypertension, or if she has kidney problems, or let's say maybe she's had preeclampsia in the past, or any kind of pregnancy condition that has caused her not to have just the normal labor and delivery. Any of those conditions can cause the mom to just need extra monitoring to possibly change the outcome for the next pregnancy. Not that she wouldn't have those conditions again or the conditions would go away, but we'd be able to follow her a little closely.
And when you talk about following them closely, that's one thing that I think is really unique about this program is that rather than having these moms and then once they have the babies, having these babies coming into our clinics, you're going to them, right?
That's correct.
So why is that so important?
Yeah, so that's important because first of all, we all know how lives of busy moms are, and that's just one less time the mom has to load everybody up into the car and get to a visit. And so she doesn't really have to think about that when she thinks about enrolling in this voluntary program. The second part of that is some of our women are allowed into the program because of social issues. So maybe they don't have a reliable transportation for every visit, or maybe they don't have a car at all. So that way, every woman who has one of these conditions that qualify them doesn't really have to think about the fact that, you know, they don't have a way to get there. So, and we all know in healthcare that can be a barrier to care. So.
And this isn't just about the pregnant women. There are babies who may have conditions that would qualify them as well. Can you just tell us a few of those?
Sure. So premature babies, babies with certain health conditions, it can be really anything that takes them off of what we call normal. So yeah, developmental delays. I've had babies that have had a surgery early in their development. And then this way we can follow these children with an extra layer. We do developmental screenings from time to time throughout the program. And we can also get them referrals to other private or public health programs to help that baby and mom and family really not only just survive but thrive in their environment, because that's what we want them to do. We want them to thrive.
Absolutely. And so how does someone get plugged into your program?
So if you go to the Coastal Health District's website and you find the Perinatal Health Partnership, then you will have all the information there that you need to kind of see if you fit into the program, you or your baby. And then you fill out the interest form down at the bottom. Once you scroll all the way down to the bottom, you can see there's an interest form there, and somebody will contact you.
Okay, that's great information. Thank you so much, Kelly.
Thank you.